What is going on, everyone? Welcome back to the Rehab Science Podcast. I'm your host, Dr. Tom Walters. Today, I am joined by my friend, Dr. John Rusin, who is a physical therapist as well, a trainer, and an injury prevention specialist. John is also the founder and CEO of the Pain-Free Performance Specialist certification, which is amazing and has already certified over 16,000 coaches, physical therapists, trainers, physicians all around the country. John also has a pain-free performance specialist book, which he's just spent almost 3 years writing. And it's currently, I just saw it on Amazon. It's out there for pre-order. And the cool thing is John's co-author, Glenn Cordoza, was my same co-author on my book. So we have a lot of crossover there. And super excited to talk to John today. He's been on the podcast before, and we learned a little bit about him and his background, but I didn't really get to dive into his whole pain-free performance kind of system, how he thinks about assessment, treatment, and training with his clients. So that's going to be the focus of today's episode. If you are someone who's interested in staying healthy, thinking about injury prevention, just continuing to do the things you like to do, staying in the gym and training, we all know as we get older, things bug us. I know I get little tweaks. My shoulders just hurt me yesterday. So what are the ways, the things we can implement, the strategies we can implement to stay healthy and to keep functioning at 100% as we age? Because so many of us just kind of get into the mindset of, oh, it's just age related, and just kind of, you hear people kind of down and depressed about this. It is what it is. And I think John pushes back on that. And I see every day in his posts looking at, how to train correctly, things you can do to implement to keep yourself healthy. So that's what we're going to talk about today. John, welcome back to the podcast, man.
Tom, it's great to be back.
Heck yeah. So now, you were on before, and like I said, I got to know a lot about your background. Just for people who don't know you, can you just kind of give us a brief kind of overview of like your education, training, and your kind of like professional career up to this point?
Yeah, so professionally educated in exercise science, doctorate in physical therapy, and I work predominantly on the subclinical side of things with injury prevention, performance enhancement, and health and longevity focused clients. So I started my career in professional athletics, did that for 10 years between baseball and football and basketball and Olympic committees and even tennis overseas. And then I transitioned about 10 years ago into more the education side of the industry, out of just a request of, hey, can you come and teach my team about pain-free performance? Can you teach us about staying healthier in the gym so my clients and my athletes can do better? And that 10 years later sparked the Pain-Free Performance Specialist certification. And we're growing fast. We've done a lot of courses at actually 20,000 certified coaches all across the world at this point in time. And I find myself at this point in time being able to be focused in on health and longevity and performance long-term, and really having my focus be education, systemization, and curriculum on how to teach people, and also coaches and professionals in the field, including physical therapists, how to mitigate the risk of injuries, but also how to train effectively around present subclinical injuries, and also integrate a more health-forward style of fitness moving forward to achieve longevity. And I think that that is my ultimate calling. And I'm so glad that 19 years into my career that I finally found that.
That's awesome, man. Did you ever think when you got out of like professional sports and people were asking you to come do some courses, did you ever think you'd have this whole pain-free performance specialist thing and certified over 20,000 people? Did you ever think it would be like this? Was that in your mind?
No. At that point, I never thought it would amount to much anything other than going out for one day on a course, or maybe 2 days a couple of years later. And then I think the market speaks, and I never had this strategic plan to be able to go and grow something this big and this robust in terms of the mark that it's had on this industry to date. But when you do good by people, when you work extraordinarily hard and you have passion and you care about serving others, whether it's education or whether it's coaching or whether it's in physical therapy and rehab, I think that's an X factor that can push you ahead very quickly in an industry that is really just struggling to be a service profession.
Mm-hmm. Yeah, people can sense that. When you come in with that kind of authenticity is the buzzword right now, but when you come in with truly like a true 100% genuine motivation and excitement for what you're doing, people sense it. You know what I mean? People can sense that passion. So, when you think about, so kind of thinking about just pain-free performance as a system, what was it in sports? Like, your physical therapy background, your exercise science background, working with all these high level athletes, like what formed the kind of foundation? Like what is kind of at the foundational level? What is pain-free performance? Like what do you think about?
Pain-free performance is a movement system that can take somebody from pain all the way up into performance, and on that spectrum at any point in time of their life, on their chronological age, but also their physical endeavors in terms of their goal sets and their skill sets and where eventually they want to be. But early on, I learned that the healthiest athletes are most likely the ones that are going to be performing at the most optimal rate. And very quickly, I also learned that am I going to make a world class sprinter faster? Probably not. That's what their coach is going to do. Am I
Sure.
going to make an NBA basketball player jump a 49 vertical instead of a 48? Probably not. That doesn't even matter in their game. So, what is my role as their coach? What is my role as the professional that's working with them? Because back in the day, I was doing rehab, prehab, and also strength and conditioning with all of my clients. And it came down to being able to make sure that they were healthy, one, and that they were able to be empowered by the way that their body felt and the way that their body functioned, knowing very well that inside of us all, we have the ability to be at our best, no matter who you are, no matter what kind of challenges that you've had in your past. But just being able to take away the things that were allowing them not to be at their optimal rate and then adding in things to make sure that they're feeling good mentally, emotionally, and physically every single day. I was onto something there because I knew the name of the game was to stay healthy so they could make money in their contracts. But
Mm.
then the epiphany came about 10 years in of like, why couldn't everyone benefit from being treated like that? Why couldn't we at 40 or our grandmothers at 65? Their stuff matters, their goals matter. All of their stuff is still pertinent to them living a high performance lifestyle, even if that's not in professional sports. So, taking
Yeah.
those same principles, looking at it as a movement centric approach, a health first fitness approach, those were the cornerstones of the system that we now know as pain free performance.
That's awesome. So I didn't realize that. So the title actually kind of speaks to that continuum from pain
Exactly.
through performance. Oh,
Yeah.
that's cool. Because I know, this is, I think when you and I finished physical therapy school, there was such a distinction kind of between the physical therapist and treating pain. And there was like the trainers and strength coaches doing kind of more movement performance.
Yeah.
And over our careers, I know early on, I finished physical therapy school in 2007. And I feel like in those early years, I remember seeing people like Charlie Weingroff and different people who are kind of bridging the gap
Yeah.
between rehab and kind of more movement based performance. And so I didn't realize that that's what the kind of name of your system alluded to. So that's really cool.
Yeah.
Can I ask you? Oh, yeah, go ahead. Go ahead.
One thing about writing a book, a 700-page textbook, is that you can really perseverate into the details on what every single thing meant. It's almost like a reflection on your entire career and the impetus of the change that you've made and the evolutions of the system and the rationale and the reasons why. We go out and teach the system, but I think the origin story is what we try to bring across to almost read like a novel in certain sections, as opposed to just be a more scientific textbook of here's how to utilize a training system to stay healthy. Because reflecting on a lot of that, and Glenn is to definitely, he's one of the muses of this, is asking the right questions and reflecting in such a way that said, what were the turning points and why are you driving so hard in this direction? Or why did you implement this strategy or methodology or technique here? And, spending 2.5 years reflecting on that, it's almost like you have the answers to why we're here today. Even though you were teaching it at a high level, you didn't necessarily know the steps or those pivotal moments that change the way that you think about everything in terms of the entire system or in terms of the entire health approach that we have.
Yeah, writing a book is amazing for that, isn't it? It's like you have all these years of practice and experience and systems and ways you do things, but when you have to really sit down and answer those questions that he throws at you and consolidate it into one resource, man, I know for me, my whole model of how I practice my system that I had always been using but never really thought of as a system, writing it down in a book, I just know it so much better. I know how I think now. It's really cool. It's even fun for me to go back and look at it now. And that's cool that you guys put yours in kind of a story almost fashion. I think you're right because there's so much information. We're just bombarded by information now. So kind of having a story of that process and those pivoting points and how you got to where you are, I think is going to help the reader. It's going to be more powerful for them in terms of implementing the information that you talk about in the book. And I'm curious, when you talked about working with athletes and kind of like this idea of like, are they healthy? What would that look like? Like, what things were you looking at in the athletes to make sure they were healthy and functioning at 100%, and they're reducing their likelihood of getting injured? Like, what did that look like?
Well, in terms of health, you can look at it two different ways. You can look at like orthopedic movement health, or you can look at more systemic, holistic health. Pain-free
Yeah.
performance is all about how we optimize the movement system to be unique and individualized to every single type of mover. And we need to throw out the idea that there is one perfect way to squat or one
Mm.
perfect way to do a deadlift. There's an infinite amount of ways, and there's most likely a handful that are going to optimally fit your body, your skill set, your past injury history, your goals, and also your motor skill acquisition and your ability to learn things that can translate into being loaded, to be fatigued, or to add complexity with speed. So when
Mm.
you think about that, that is the cornerstone of the way that we're trying to teach and be able to look at, hey, not everyone can go through a cookie cutter program. Not everyone going through professional athletics, baseball 10 years ago, they would have 300 people between their major league teams and down into their minor league system. And in the off season, every position player would get exactly the same program. And then
Mm.
every pitcher would get exactly the same program.
Wow.
But you had so much diversity in terms of body shape, body size, anthropometrics of the shoulder and hip joints, spinal structure, limb lengths, and then, of course, all of the mileage that has been put on those bodies over the
Mm.
years. So the big question was, how could anyone ever train the same way, even if they
Yeah.
did have the same goals, which is to compete at the highest level? So I think over a decade's period, looking at solutions to make training accessible for everybody, to make training a net positive for everyone, it had to come with diversity of movement selection. It had to come
Mm.
with diversity of movement sequencing and being able to go one or two steps deeper than just making the right decisions in terms of XYZ clinical diagnostic to make it actually come to life in the real world.
Yeah, totally. So was that your role in professional sports? Were you doing a lot of personal assessment so you could individualize programs for the athletes?
It was twofold. So I
Mm.
did more like personal training, if I'm going to be
Yeah.
completely honest. So an athlete
Yeah.
would come in and you're basically his personal trainer, you're his nutrition coach, and you're his physical therapist. You work for multiple hours a day, multiple days a week. And this is usually happening in the off season. And then on
Mm.
the other side of things, I did a good number of consulting jobs where you'd go in and you'd look at big scale change to the way that some of the systems were run, some of the programming, as I just mentioned, was run. Decisions: do we trap bar deadlift everyone or do we
Mm.
RDL everyone? It's like, these are really hard questions to answer, but trying to make the best decision possible for the masses. So large scale programming and then individualized, more personalized coaching.
Yeah. Well, I love what you said before because everyone's body is different, right? And we're seeing this over and over again, that the old ideas of like, you got to squat this way or move this way. It's like people just, our musculoskeletal system develops based on the stresses that are put on it. And especially you see that in athletes, right? Like you see just the way their bodies will be altered because of the unique biomechanical stresses they put on their system. So I love that you're thinking that way. Now, when you like, if you think about in the book, I know you go through different kind of movement screens, I think, and assessments. What does that look like? What would the person go through to kind of figure out where they have impairments or weak links, things like that?
Yeah, it's a great question. So, six foundational movement patterns are going to be the movement system of pain free performance. So, that's squat, hinge, lunge, push, pull, and carry. So, it's bilateral squat, bilateral hinge, single leg asymmetrical stance, lower body directed movements. And then you have push and pull of the upper body, which could be horizontal or vertical force vectors. And then carry is essentially locomotion of moving your body through space with a stepping mechanism, whether that be walking, sprinting, crawling, anything that actually locomotes the body in reciprocal form. So we're trying to establish a baseline for every single person right off the bat. And what we do here is be able to go through a quote unquote screen. It's not a pass or fail, but it's more of a litmus test to see where you currently are in terms of your movement quality, your movement quantity in terms of range of motion, but also your more subjective, which we try to quantify, which is your ability to be smooth, authentic, and be able to simply move for your body, not for somebody else's.
Mm.
And we go through simple screens that are body weight based or very light loaded, something like a goblet squat, something like a single dumbbell RDL, split squat from the ground up. And we're able to actually look at a couple of key things right off the screen. Our screen in pain-free performance is about a quick judgment decision in 5 to 7 seconds, whether we feel great about somebody training that day, like, yeah, awesome, go after it, or hey, we need a little bit more information. And our two qualifying factors are spinal position. We want to stay in the neutral zone of spinal orientation throughout all aspects of the movement's range of motion. And then we also want to be able to have rotation managed. Rotation is part of every single one of these foundational movement patterns, but the way in which we manage rotation, so it's most likely smooth, it's symmetrical, and it creates synergy with the rest of the body. Those are the two qualifying factors that we feel really good about somebody moving on into a heavier load or higher speeds or more fatigue. Or, you know what, something's not quite right here. So we're going to take a more deep dive assessment in to actually see what's going on underneath the skin, because many times we forget that there are highly, highly complicated and misunderstood mechanisms in terms of the biomechanics and the arthrokinematics that happen at some of these more complex regional joints.
Yeah. Simple movement screens like that are so powerful with just body weight, to just watch someone move, look at their movement quality, look where are they shifting? How much range of motion are they willing to go through? Do they have any symptoms? You look at a squat, like what does their lumbar spine do? Just all these kind of little things you can glean from just a quick 5 seconds watching somebody move. And then, like you say, you can kind of go in deeper if something stands out. With those screens, it sounds like you would do those maybe at the beginning of every session before a workout?
Yeah, so it would be naturally built into something we call the 6-phase warm-up sequence, which is another key section of the Pain-Free Performance book. So we look at being able to build in a 10 to 12 minute pre-training sequence to be able to optimally prepare the body and also the mind for pain-free training. And we go through things like phase 1 foam rolling, phase 2 stretching, phase 3 corrective exercise, phase 4 activation drills, phase 5, which is the movement pattern practice and preparation, which we would screen at. And then phase 6 is more twitchy, high velocity CNS-based movements to try to amplify post-activation potentiation. But when we screen, we want to naturally build it into the movement sessions so we're not clipboarding people. I think one of the things that has fallen out of popularity in physical therapy and in personal training today in 2025, different than even 10 years ago, is this huge, robust screening protocol where you tell everyone that they're broken. You tell everything what they can't do. You tell everyone that they're at risk of XYZ injury. And you forget to tell them, hey, your body is strong. Your body is resilient. You have full access to all this stuff. And the things that you don't have access or confidence in today, we have a system to rebuild that so you can gain that confidence back. And I think that is the big motto behind pain-free performance, is that we want to be empowering movement. We want to be empowering strength training. We want to be empowering quality of movement so we can have longevity with it. But we want to naturally build in screens and assessments where the client almost thinks that they are training. They think that they are going through a movement session, they're going to elicit a training effect. And then the coach gets their qualifying data where they can make really good decisions based on that client's goal sets, but also that client's safety in that day.
That's really cool. So that's a 6-step sort of warm up, and you said it's normally about 10 minutes.
Correct.
Something like that. Okay. Now in the book, do you teach people are they going through that on their own?
Oh, yeah. So in the book, we have chapters for each and every one of the 6 phases. And then I go through and identify probably 10 or 15 distinct exercises that could fit within each phase, where it's like, man, I use this all the time with people. This is a no-brainer. And I teach every single one of those. And then we've actually organized it in such a way that no matter what your training looks like, no matter what your goal is, no matter what your range of motion limitation may be, or your chronic pain point may be, we have 6-phase dynamic warm-ups built out for your performance sessions. And then we also have pain and performance blueprints for you to be able to go in and start utilizing a phasic system to be able to work on something like, hey, ankle mobility so my knee doesn't hurt anymore. Hey, we're going to work on hip mobility so my lower back can be less painful. And then we go site by site in terms of the most common pain points and linchpins that I tend to see with people's movement systems. So those pain blueprints are really versatile because, as we know, people need to do their homework in addition to training. They need to do their homework in addition to warm-ups, and they need to do something, in my opinion, 10 minutes a day that's just daily body maintenance. But instead of doing something general, if you do have distinct limitations, why not go after that directly to be able to make some changes in your movement system?
Mm-hmm. Yeah. I love that. I always talk about people with a sort of like movement hygiene. Like we talk about sleep
Exactly.
hygiene and brushing your teeth. We have different hygiene practices. And I think movement's another great one for people just to think about in that way. So can you I haven't seen your book, so I don't know as somebody's flipping through it, do they go through are the initial chapters after you get past the intro and things, is it focused on these six? How's it laid out?
Yeah, that's a great question. So we have 4 distinct sections of the book and 18 chapters.
Okay.
And with the first section is all about the principles of pain-free performance. The foundational skills that no matter who you are or what your goal is or what your pain is, that this is worth mastering because it's going to be able to potentiate everything that comes next. So we're talking about things like bracing and breathing and zones of neutrality at the spine and other joints, and things that aren't necessarily the most exciting, but they're the ones that if you can get right, all of a sudden you feel and function your best, even without knowing the system. So that
Gotcha.
is all about movement mastery and the ability to lay the foundation for quality tenets of pain-free performance. That's section 1.
Okay. Yeah.
Section 2 then transitions into the phasic system for pre-training preparation and something called the performance recovery system with the pain blueprints, where we're able to have distinct chapters on things like soft tissue work, stretching, correctives, activation, all the things that I mentioned before. And
Yes.
those are information loaded chapters because there's a lot going on, but the big takeaway is that you can put it together as a system. Foam rolling without stretching is less optimal than just stretching. Things like that where we can actually put the pieces together. But I think the most exciting for people is to get through and look at section 3, which is the movement patterns themselves.
Nice.
Most
Okay.
people are going through multiple of these movement patterns. We have an auditing structure that looks at, hey, are you training all 6, squat, hinge, lunge, push, pull, carry? And going even a step further, what's your entry point in terms of your accessibility for exercise selection? One exercise isn't equal for everybody. So where's your accessibility point? And that accessibility point in terms of its executional detail is more individualized based on the assessments that we have. So we have anthropometrical assessments that individualize each and every one of these foundational movement patterns. So it will be unique and distinct to you as an individual. And it will never be another cookie cutter textbook approach to everyone squatting the same way. And I
Yeah.
think that's the most powerful thing that we've brought through over the last 10 years of running pain-free performance specialist certification courses is the common sense thought that if people are built differently and they have different mechanics, why would it be optimal for them all to move the same? And we take it 10 steps further in Pain-Free Performance book to show you the exact protocols to determine exactly how you should be in a split squat, exactly how you should bilateral squat to maximize strength and range of motion, to be able to go through and qualify your hand position in something like a push-up all the way up to a bench press or an overhead press, and even looking at locomotive practices of, is this actually the way that you should be walking and running? So I think that is very empowering for people that have maybe been running into roadblocks trying to do the cookie cutter textbook approach to everyone the same. Because when somebody tells you that you're a unique individual, you're like, yes, I am. But then it's one thing to say it, and that's another whole thing to give them the tools to be able to identify how they are indeed unique.
That's really cool. So it's based on anthropometrics now. Is it a visual sort of this is what my body is like? Or are they actually measuring themselves? How does that go?
Yeah, so we're actually taking raw data. So
Hmm.
through 20,000 people at our live courses, you'd imagine that we get a lot of routine and we get a lot of data points to say, hey, we know what works and we know how to teach what works to lay people. I think that's one of the things when sometimes we go through these really, really robust orthopedic assessments in clinical care where it's not necessarily repeatable for everybody, fitness
Mm.
professionals or lay people. So we've made it in such a way that we can, in a matter of 2 to 3 minutes, take the measurements, take the positions that we want to translate through. And a lot of this is based on spinal structure, shoulder structure, and hip structure in accordance to limb lengths at the lower body.
Mm-hmm.
And we're able to position them in such a way that they should feel strong, they should feel stable, and they should feel like they have capacity to move freely because from a biomechanical perspective, we position them in the most optimal rates.
Hmm. And so will people in the book, they're identifying their sort of unique structure, and then you're helping them guide them through those movement patterns and how they might modify their position to move in
Exactly.
a way that feels good.
Yeah, one of the most popular things over a course that we've been running the last 10 years is something called the hip quadrant test. The hip quadrant test is used to identify the deep hip structure of the hip joint itself, knowing very well that the angulation, the depth, the orientation of the socket is going to be totally different person to person. And in some individuals, it's going to be different right to left. We have pretty good data showing that we have anywhere from 12 to 17% discrepancy in the average person between their hip structure, right hip to left hip. And all of a
Wow.
sudden, we're like, hey, I thought your feet should always be in this exact same position, right to left, in terms of your squat setup. Maybe, maybe not, based on your individualized approach. But we're able to do a positioning in the open pack position to be able to show how high we can get the knee up towards the chest, what angulation of abduction and external rotation we can add into the mix. That translates down into the butt to floor distance. It translates into your foot position. It translates into your knee position, but also to have the ability to maintain spinal neutrality within all of this. So,
Mm.
utilizing these types of anthropometric assessment tools, we can quickly show that somebody has been squatting with wide feet. Maybe it was a total mismatch for them. Maybe you should have been in a narrow foot position with your feet directly forward, as opposed to somebody who was shoulder width apart, toes slightly out. Maybe you should have been wide squatting this entire time because your hip structure has dictated so. So we're
Mm.
able to explore some of these things, knowing very well that the principle of central line stabilization and joint centration is our North Star. The more stable we can create a joint or a region, the stronger it has the potential to be. And then obviously there's different remediations, and we go into the 6-phase dynamic warm-up system and the preparatory systems and exercise selection to be able to integrate all of this for motor skill acquisition. But many times we see people are just simply training against what their body needs, knowing very well that no matter how much they practice, how good the coaching is that they get, if you're simply squatting with your feet in the wrong position based on your body type, you're never going to have the best amount of success.
Yeah. Yeah, I can totally speak on that one personally. I have from years of martial arts and gymnastics, have a labral tear in my left hip, and bilateral squatting has been, I know for me that, if I'm narrow or internally rotated a little bit, that hip is very different than my right hip. And I can force myself to get all the way down, but it'll really flare at my hip and and I feel it. I get the kind of groin type pain. And so my left leg compared to my right leg is very different. Like I do better with my left leg being more abducted and externally rotated. My right leg can be almost like dead on center. And so I've had to play with that over the years. But I think, most patients and clients are under the impression that they need to be symmetrical. And I think people are getting to understand more that, maybe you don't have to have feet shoulder width and straightforward, but some people still feel that way. And gosh, I mean, you can in the clinic too, right? You have people lay down on the table and you see how different they are in terms of one leg's really externally rotated, one like just how unique people are side to side and how different that pelvic and hip structure can be. So that's really cool that you're looking at that and just thinking in a way that's so unique to people. I've seen more and more. Nobody taught me about this back in my exercise science days or PT days, but the idea of kind of thinking about anthropometrics, like I have very little trunk. I'm really long legs, which is great for Taekwondo. I kick people in the head easily, but I have long femurs, and I slowly come to learn from the strength and conditioning world, like how that might impact something like a squat pattern.
For sure. We all get stuck in these cookie cutters. Like, oh, you go in and you chat GPT or workout. Please, everyone, don't do that. It won't end up well. But when you go through this stuff and it's, one size fits all approach, one size fits no one. And looking at trying to take your unique needs and all of a sudden now you have an optimal setup for your squat pattern, not a squat exercise, but your absolute human squat pattern in terms of movement capacity. And then all of a sudden you have decision making to be had. And that's what the movement pattern sections have following the assessments. It's like, now it gets fun because now we have the access points of how to actually train this, how to get big, how to get strong, how to chase bigger and heavier weights, how to chase your goals, and where does it come with the movement pattern pyramids. So the pyramid is essentially a progression and regression scale that will layer in motor control and also loadability all the way up a pattern to be able to have a step-by-step stage progression for every single person's pattern. And one of the things that I've been doing my entire career, naturally I was doing it just because I thought it was right. But now after all the data that we have, I'm more conclusively knowing that this is the right move to make, is when people are having chronic pain, when people are having performance plateaus, we have to move backwards before we move forward at an increased rate. And a lot of what I do now with my consulting with individual clients is go through and rebuild these patterns with them. So step one is to be able to say, hey, here's how your body should uniquely move. It's one thing to say that, and it's one thing to position them in body weight. It's a whole nother thing to now start to create a more robust movement system that has more diversity in its skill, but also have more loadability in terms of its capacity. So that is where the rebuild phase comes in, but it all starts with your entry points into where do you start the squat pattern again in a pain-free way? How do you take it from pain-free all the way up to performance, chasing these pyramids? And this is what we essentially get into in the fourth section, which is the final section of the book, which is a crazy, crazy detailed programming section. It's
Nice.
it's wild. We have 5 different programming tracks. It is crazy, from full body training to movement pattern splits to upper lower splits, all focus on pain-free performance, health, and longevity based performance training. So the detail that we've done in that, it's something that we're all really proud of.
That's really cool. So wait, so section 3, the foundational movement pattern, so 6 movement patterns, that's not an assessment section. You're kind of, are you learning how to perform those movements well? And then in section 4, you really get programs for, is that right?
Exactly. So section 3, every movement pattern will have an entry point of what is the big problem with these movement patterns? Why does everyone really seem to be struggling with bilateral squats? What the hell? I thought this was supposed to be easy. My professional recommendations on that moves into a quick screen to be able to create a control group to test against your assessment, which is going to be your individualized approach to moving towards your unique needs, and then having an entry point in terms of the movement pattern pyramids, and then being able to take it one step further in the section 4, which is now go and train them.
Got it.
Yeah, it has diversity, and it also has a lot of I would say inclusive abilities for everyone to be able to be successful in training, making it accessible. No matter if you're having hip pain, you have a lower back disc bulge, or you have a shoulder that doesn't move through full range of motion, every single program will have access points based on your individual need. And also we'll have an ultimate program that it's like, hey, if I made every qualified decision to be shoulder friendly, back friendly, knee friendly, hip friendly, this is going to be it. So we went in only wanting to do one program, and it ended up being 5. And then we 5X down, I guess.
It's so hard to fit everything, especially when you have a page limit on a book. I know we ran into this too. It's like there's so much. You could have a 1,000-page book, I'm sure, and just like keep building it out. But it's like the binding falls apart. Well, can you give me an example? Like, can you break down what any of the movement patterns, and then kind of like, can you just take me through an example of like somebody that might come in and how you guided them through this process, how you set them up, and then kind of like a progression?
Yeah, that's a great question. So let's use the squat example again, because we kind of already got into that a little bit. So squatting would be something that I would see that is probably deactivated in many people, especially the bilateral squat. So really looking at, hey, are we actually training it? That's the question. If we're not, if we are, it doesn't really matter because we are going to re-audit this right from the get-go, no matter who you are. I've had
Do you
thousands.
mean like what are they actually training? Like they're using the wrong muscle groups, or they're what do you mean by that? Like that it's deactivated?
They're not squatting at all. How many times have we heard that? So from a bilateral squat perspective, one of the first things that we do and like audit the entire movement system is look at, are we getting all 6 foundational movement patterns trained every single week? So are we squatting, hinging, lunging, push, pull, and carrying? And
Oh, like it's not in their program. They're just not doing it.
they're not doing it for
Got
many
it.
different
Got it.
reasons. Are they
Yeah, yeah,
not
yeah.
doing it because 2 years ago they have a catastrophic injury, lower back blew out in the squat rack, and they vowed to themselves that they're never squatting ever again? But only problem is you still have to go to the bathroom every single day. You could be doing that for the next 50 years.
Yeah.
Or is it something that, hey, over the years, they've really just, I hate to say butchered the patterns more and more, where we see it maybe with the 40, 50, 60-year-old guys, where it's like, I'm going to barbell back squat for the rest of my life. And the range of motion gets less and less and less. Stance gets wider and wider and wider. And all of a sudden, you're not training that pattern anymore. You're just justifying doing an exercise to keep it going somehow, some way, even though it's hurting your knees, your back, and your shoulders to get your bar into position. So we're looking at, are you actually training? And if you are, let's take it one step further and screen the pattern itself. So the screening would take through, somebody would go through and go, hey, we're going to look at the lightest kettlebell that you can hold. We're going to hold it in a front rack goblet squat position. And you're going to be able to do 3 reps to the best of your ability. And we're going to take a look at the qualifying factors, which are spinal position and then the management of rotation. And then from there, coach's eye is very keen, but we've qualified it in such a way that anyone can screen themselves. We're doing it in mirrors, and we're also being able to have directions where you can screen from the front and the back using your iPhone. And from there, people will be like, that didn't look awesome. That didn't look awesome. And if it did look awesome, maybe people go right into the programs right away. But most people, especially the ones that are coming in for pain-free performance, they're looking at better and optimal and trying to continuously move the needle in terms of their movement basis. So that's when they would go directly into the assessment. They would go through, assess themselves and go, hey, wow, this is my new foot position. This is my new knee position. All of a sudden, like, this is my glass ceiling of what my bones allow me to do in terms of my depth. And then, hey, I know I'm going to need some practice from here. Where do I go in terms of an entry point of body weight to goblet squat, to front squat, to back squat, and all the way up that movement pattern pyramid? So they have essentially their entry point. And then they take that entry point and they go right into the programming. And when it says squat pattern, they have the optionality to be able to customize their entry point right into that. And this is mostly done on something called a key performance indicator lift. A key performance indicator is essentially the biggest, hardest, heaviest movement pattern that you'll be doing that day. It is free weight. It is also loaded in more of like a traditional strength scheme. And it's something that you are going to look at a progression over time, whether that be movement quality or the one that people definitely gravitate towards is loadability. Essentially, you're getting stronger over time in this pattern because movement skill is a strength, or strength is a skill, but also we're able to create a more robust system around the pattern itself.
Yeah. Okay, that helps a lot. I'm having such a better kind of mental model of how this system works. When they're going through the book and they don't have that, specialist right there in front of them, what are the movement assessments? So say I'm still in the squat and I'm trying to figure out my entry point, and say I'm either looking in the mirror or I've got a camera, phones, like, just recording is so powerful to be able to see how you move. What might they be looking for in that to kind of figure out their entry point, to kind of get to like, this is my best stance or position for this movement?
Yeah, for the squat, it's going to be looking at it against your control group, which is essentially your screen. How have you been squatting? That's going to be your foot position, and it's going to be your ability to get your ass to a relative distance to the floor. And that's what we look at in terms of like a range of motion. And we essentially want to get you into a more optimal position in the assessment that allows you to be more fluid and free, to maintain spinal neutrality, to get more range of motion with your butt closer to the floor. And maybe that totally changes some things. Maybe that changes your flexion moment or your chest down moment in terms of your torso angulation. Maybe that shifts your knees over your toes a little bit more, or opposite. Maybe that allows more external rotation to get deeper into the squat to keep the hips centrated. But we're essentially looking at a simple test to say, hey, how did it feel subjectively? That matters a lot when it comes to movement.
Yes,
In training. Like, subjectivity is huge, but also objectively, we see in our courses that we are able to increase people's ranges of motion right away. 6, 8, 12. We've had up to 19 inches of increased range of motion out of bilateral squats in a matter of about 10 minutes of going through this in live coursework. So we see that, hey, more range of motion is better when it comes to movement patterns, because one of our core tenets is to be able to establish a full and complete range of motion at every single one of these foundational movement patterns as our starting point. Because if we can strengthen and if we can create stress through a more complete range of motion, that is going to be great for the joints. It's going to be great for our musculature. It's going to be great for our brain to be able to learn how to restabilize these positions. And it's just a more complete pattern at that standpoint.
Yeah, that's right. It's like in life, you want to be able to use your maximum range of motion and use it well. And then when you start thinking about muscle hypertrophy, right, we see all this stuff on just when you lengthen a muscle, you get that better stimulus for hypertrophy and strength gains. So, but I think both of us coming from the physical therapy kind of lifelong health standpoint, yeah, you want to be able to move through your full range of motion, move through that with control and have strength. And I think you and I both, I really like the kind of like motor control, sensory motor control area. And it sounds like you guys do so much of like
Yeah.
helping people hone in on like, what is my movement quality like?
Yeah.
And yeah.
Well, here's a totally other situation of going through that exact progression. Okay, you learn, you audit. Are you doing it? No. Let's screen it. Let's do your assessment. All of a sudden, your assessment's so new and novel, you're like, holy shit. Like, I was squatting with my feet 40 inches apart, and now I'm 9 inches apart. This is like, your first guide back into squatting. At that point, we don't go, hey, yeah, let's throw a bar on your back and see how this goes. We have a more qualified ability to go back into that motor control, that motor skill acquisition phase. And we do that by going back into section 2 and identifying what's the key 6-phase warm up that we can start working on these pieces, whether it's tissue quality, whether it's tissue, isolated range of motion with stretching, corrective exercise to be able to open up that motor control gap, and then be able to restabilize it with activation. So we put them back into there and be able to start building up the pieces of the squat and looking at the linchpins or the limiting factor in more of a concrete way. And if somebody does go through and they're like, man, I'm still having back pain or knee pain or shoulder pain while I'm squatting, we have specific protocols that they can go through specific to that pattern itself to be able to start remediating that right away as we're doing this rebuild phase.
That's really cool. Gosh, I'm really excited to actually go through this and apply it to myself, because I just know there are patterns, especially in my squat, my bilateral squat, because of this labral tear, which really only became symptomatic in the last 10 years. That, and I had a really kind of more nasty proximal hamstring tendinopathy that's affected my deadlift. And every time and so I know I don't deadlift. I'm not, like you said, I'm not doing that pattern as much as I should, because it just kind of hurts and I don't enjoy it, to be honest. Like, I don't enjoy deadlifting as much as some of the other movement patterns, but I'm really excited to go through and kind of assess myself from your perspective. Like, it's so refreshing to have a different perspective, because we all kind of, as practitioners, get in our ruts of how we do things. And I think I've always valued these 6 foundational patterns. I try to implement them always into my strength training. But, I have some pains in some of those patterns and ways that limit my range of motion. And man, if I could find ways to kind of increase that range of motion and feel better while I do it, it'd be so fun to learn that.
You will learn it. And this is a conversation that over the last 2 years, Glenn and I have almost every single day, because you look back on building pain-free performance, and it's like the fastest growing and the biggest fitness certification on earth today. And you're like, why? why was this so popular? Why does
Mm.
this continue to be popular? And why a decade later are people still gravitating towards it, even though the industry has totally turned over, especially with COVID? And you go back to teaching a system. When you
Hmm.
teach a system, it is very complete and inclusive to everyone because everyone can benefit from the same principle based system. It means that you have buckets, you have areas that you can customize and individualize on, but we know very well that you're covering all of your bases.
Hmm.
How to put the pieces together all in one place, in one time, with one resource, in one program, and have those pieces look totally different person to person. That is what I do believe gave Pain Free Performance the success that it's had. And it will continue on with that success because as we look at many of the different books out there in the marketplace today, many of the certification courses, many of educational resources, or even Instagram channels, it's so niche and it's
Hmm.
so tool based. Hey, what are you doing? I'm only powerlifting for everyone. Fuck you if you don't want to do this. Or,
Yeah.
hey, you're only doing corrective exercises. Weightlifting is going to hurt you. Or, hey, yoga is the only thing that we're doing. Oh, TRX is the only tool that you need. And everyone's so siloed into one thing. At Pain Free Performance, I truly believe that whatever you want to do, you can do within the Pain Free Performance system. And
Hmm.
that's liberating the people. So when our coaches come to the course and when people start reading this book, they're going to be like, wow, this is the roadmap to put all the pieces of all of the noise that I hear online every single day together to be able to make it unique for me. This is
Hmm.
exactly what I wanted out of my perfect program. And I
Yeah.
think that us being non dogmatic in that way and not having a hard stance on one thing versus everything else has made it to the point where we will have physicians come through that are new to exercise. We'll have physical therapists that work in professional athletics. We'll have personal trainers and strength coaches that are working in bodybuilding and powerlifting. But they'll all have the tenet of wanting to be healthy and knowing very well that aches, pains, and injuries are the number one reason why people don't achieve their goals, short term or long term. If we can all agree on that, then this is going to be the system for you.
Yeah. Well, it's like you said at the beginning, it's a movement centric approach. So it's not like some of these other things where you're just in one niche or one kind of strategy or model for helping somebody move. It's like you're thinking about what are the foundational movement patterns? How do we actually give you that entry point into that movement pattern? And then how do we design programs based on your unique body structure and movement? So I think that is nice because you get tired of people just kind of promoting their system that they think is the best for you. You like the non-biased kind of movement, kinesiology focused approaches. That's how we should look at the body, right? Like
Right.
it's we're all so unique from a movement standpoint. To think that you can have a kind of one size fits all is just inappropriate. Humans are very different. And that's what's so cool about the movement system, is that we are so unique. You were talking about during the assessment things that you look for. I think you said like the rotational, or you said kind of neutral, staying close to neutral spinal alignment, and then a rotational aspect. Are those the two?
Yeah, so it's not a
Yeah.
rotational aspect at the spine. The zone of
Oh,
neutrality will be flexion, extension, side bending, and
yes.
obviously rotation at
Okay.
different lumbar areas, thoracic areas, and of course the cervical spine as well.
Got
Kind
it.
of looked at
Okay.
as a functional unit. But what
Yep.
about everything else? So when we're looking at unwanted rotation, we're looking at anywhere from the foot contact on the floor all the way up into the knee, falling into varus or valgus moments, how that orientates with the hip, falling into disalignment, or even the pelvis dumping, all the way up into the shoulders in the way that we're able to utilize that ball and socket based joint to gain or maintain stability. So, looking at things from a symmetry and a management of rotation perspective in the lens of screening quickly in a couple seconds, that still holds true because a vast majority of people will be symmetrical with
Mm.
their positions on five if not six of the movement patterns. But
Yeah.
if you're the one that falls through the cracks, we're going to make sure that you don't when you go through this resource.
Hmm. It's so cool to like just break it down into those kind of two things, like zone of neutrality and then looking at rotation. Because really, that is a lot of what we do when we do movement screens, is kind of look at, there's all these different terms and things for them, but you can kind of break it down into two nice buckets like that. So that's pretty cool.
We have some really cool creative assets that we developed with the zones of neutrality and also rotational components through multi segments of the body. And we talk about it for an hour in the live course, But in a matter of 3 pages, you're going to be like lock in that, because this is exactly what we've seen anecdotally, our entire careers of like, movement quality matters. The way that you
Mm-hmm.
move absolutely matters. Movement mastery matters. And biomechanics are definitely still a science. But the way in which that is contextualized into every pattern and also for every individual, it's going to have some leniency in terms of there's no perfect neutrality in terms of spinal position. That
Sure.
just doesn't exist. But we do have an acceptable zone where we know we're putting ourselves in the best possible position. But also, what is the context of that zone? Are we being rapid force eccentric flexion moments of the lumbar spine at L5, S1? We know that's not awesome, especially when deadlifting or utilizing heavier loads in some of the compound patterns versus, hey, you're going to go through that exact same position, but you're going to be holding a stretch while deep diaphragmatic breathing, and we're going to be accessing that range of motion and that segmental joint flexion. That's a totally different story. So putting a little bit more context and nuance into some of these core principles, we've done a great job at being able to bring that forth a little bit more clear and concisely than we've ever done in the certification course in section 1 of the book.
Nice. Okay. Here's one that people always ask me about. I want to hear your thoughts. How do you feel about the butt wink during squats?
Great question. So it definitely does break from a screening perspective some of our cardinal rules. So it is a loss of spinal neutrality. Obviously, it's a combination between posterior pelvic tilt and lumbar flexion. I don't love it. If
Yeah.
that's something for pain-free performance that we want to be able to hold movement quality being true, we want to be able to have a lack of butt wink. Do we know that maybe it's going to happen? It's going to happen to everyone if they exceed their ability to be able to stabilize a range of motion that they have control over. But it's something that it's not a performance enhancement tool that I go in and teach, similar to what CrossFit did 10 years ago. It's definitely a sport-specific skill if you're going to utilize it in Olympic lifting, which I don't coach anyone on Olympic lifting any longer. But it's one of these things that I do believe that it won't hurt you now. It probably won't hurt you next week or maybe next month. But eventually, when we have that type of concentrated stress mixed with load and speed, because essentially a butt wink is a rapid moment where we have a flexion extension moment at one of our most vulnerable areas of the body. That's just not something long-term that I'm interested in putting that directed stress on that specific site. I think we can get that stress in different positions that I feel a little bit better about. Going into a posterior pelvic tilt on a single leg, I feel way better about that because we have more rotational components. But in terms of a strict bilateral stance, bottoming out with a butt wink, it's not something that I teach, nor have I ever taught. And it's not because I think that somebody is going to have a catastrophic injury today. That's not the way that injury prevention works. It's just we only have so many bullets in the chamber of our gun. We just want to shoot off those stresses intelligently for the holistic nature of somebody's movement system.
Yeah. It's one I think about a lot because in bilateral squats, because of my hip structure, I think to some degree, and that labral tear in my left hip, I hit a point where in the range of motion, if my hip joint ends its flexion, especially my left hip, it ends, I hit my maximum flexion range, which is less than my right hip. And if I go beyond that, I will really go into posterior pelvic tilt and lumbar flexion. And I am somebody who's lumbar flexion sensitive. So like if I sit for prolonged periods or I'm down, because I can squat butt to the ground, it's just that I'm very flexed in my lumbar spine. And if I hold that position, like if I have to be down doing it, my back will be painful, like for the rest of that day, maybe into the next day, it'll be kind of flared up. So I'm very cognizant of how much time I'm spending there, kind of the volume of time I'm there. But then like things like, it's interesting to hear you kind of differentiate a bilateral squat and like a single leg, because I can single leg pistol squat all the way to the ground, but I do also get I still am getting a bunch of posterior pelvic tilt. It doesn't seem to bother me as much though.
You don't have the pain the next day, do you?
I don't, not with single leg. Yeah. Yep.
It's
So it's interesting. Do you think, I'll just be really curious, like to go through your system and see like, because I just sort of got to the point where I was like, well, that's the structure of my left hip. I have pain when I do that. I'll just be curious to go through and like assess it and see, maybe I do need to change up my stance and entry point in that kind of pattern. Maybe I've been doing it. Maybe there are things I need to tweak.
Yeah, an important thing that we always say with a lot of the assessments is that we're looking at the bones and we're not looking necessarily at soft tissue at that point. So any of the anthropometrical assessments that we do specifically to the hip and specifically to the shoulder for the squat pattern and also for the push-pull patterns, vertical and horizontal, it is going to be based on actually the joints themselves and the bones themselves, things that we can't out-train. So it's
Sure.
like if you know that this is it, unless you have chronic stress over years, if not decades, that will reformate some bone in different ways, this is what you have. So knowing very well what you have that you can't change in terms of decision making for your own training and programming, that's liberating because you know, like, man, I've been battling this for my entire life. And then, oh, that's why. And now you can make the qualified decisions to train intelligently around it as opposed to continuously force feeding. But to the point of going through and choosing different patterns to have maybe different cardinal rules broken, I think at the end of the day, a perfect training program for every individual is going to look different, but it's going to establish a full range of motion being trained under load at every single joint. And I think that if we can think about it like that, that seems really complicated. It's like, oh my God, my wrist has to flex and extend. Like, how am I supposed to get that? And all of my fingers, it doesn't have to be that complicated. The way in which we've built the pain-free performance training system is that as long as you go through the screens, assessments, the movement pattern pyramids, and you follow the programs, you utilize the 6-phase blueprints, you will have complete training. You will have complete ranges of motion. You'll have the volume distribution that we need. We'll have the frequencies of each pattern for motor acquisition and learning. We'll have everything covered, and we will put all the pieces together for you. Because many times we get so acute in our thought that, hey, the squat's really going bad for me. I need to double down on the squat and forget about everything else. It's about maintaining what's going awesome, continuously making gains with that, but knowing very well that the domino effect happens when we start making market improvement in the things that are holding us back. What is the broken link in the chain that we can reassess and we can redistribute with a different means of programming that allows you to reintegrate your chain again to be stronger?
This is awesome, man. This is awesome, John. I'm so excited to. I really didn't know how your system worked. I haven't been to any of your courses, and I see your Instagram posts and things, but it's just a little taste of, it's not like you're ever getting the full thing. So to be able to have a conversation like this and kind of hear a little bit more about it, and I'm just excited. I'm really excited. It's always refreshing to hear someone else's perspective, how they look at things. Like, you always get these little nuggets of things, and I think I'll probably get a lot of nuggets from what you do, but I'm really excited to get the book and go through your system and selfishly kind of apply it to myself, because that's what's cool about it, right? It's not just information, it is application. Like, you can actually go learn and then go like test yourself and make yourself better. And like, we all have this body, this musculoskeletal system. We all should, I think we all hopefully will be empowered to learn about it and to improve the health of it. I always tell people, like, we all have this body. We all have a musculoskeletal system. It's such a shame that the education system doesn't teach everyone, doesn't force everyone to take a kinesiology class or something like a biomechanics class, like learn about your body and just how, just what are our different movement capabilities and how can I improve my health. So thanks for being on here. I know we're just kind of brushing the surface of your system. I think I'm just barely getting an idea of how it works, and I probably still am not understanding much, but I'm super excited to get the book. I know I was just looking at it on Amazon. That's up there for pre-order. Congrats on making it to the finish line. We both know it is such a marathon to finish a freaking book, especially when it's textbook size and you're covering the whole body and it's so comprehensive. So congrats on that.
No, thank you. And, because Glenn and you worked on Rehab Science, and it is a world-class resource, one that I recommend to almost every single person that is in pain. I look at the principles that you were able to teach in that book and being thrown through a different lens in terms of a performance basis and training. And it really set a high standard for what I definitely wanted to attempt to achieve with pain-free performance, knowing very well that I'm looking at it on my bookshelf right now. I have 2 copies of it, and it's been something that I go back to time and time again, as I think it is one of the best, if not the best, practical rehab book ever printed. And I'm so excited to see the success of Rehab Science as well, because you can tell when you release something and then it continues to sell and sell and sell, it's because it's quality. It's because it's helping people, and it's because it's moving the needle in terms of the goals of why you did it in the first place, which was get protocols accessible to all people and be able to educate them. And the success that I've seen, even like a year plus later, most books will come and go and book and die. And you guys are killing it more, this month than you were a year and a half ago. So congrats on that. You've just set a high standard. And I'd be lying if I said that I didn't think about Rehab Science majority of the time, trying to do my best work, knowing very well that like within the Victory Belt publishing house, like we're trying to create the best in the just the best resources out there to help people. But when I'll put Pain-Free Performance up against Rehab Science on my bookshelf, it'll be super cool because I just think the world of what you've done and what Glenn and you have achieved with that book, and then just taking it one step further with Pain-Free Performance, it's gonna be super cool.
Well, thanks, man. It's been such a fun journey, and I know I'm always looking at the bestsellers in exercise and fitness. I know I'm going to be seeing you up there. I'm always seeing, certain books are there, and I know you're going to be in there too. I think just the framework, that you're coming into it with the movement-centric approach. I think people are going to not only get like all this great information, but they're going to get something that everyone can apply to themselves and can improve how they move and how they feel moving in their body. And so I think a resource like that is going to continue to just be evergreen and popular with people because, like I said, we all have this body, we all have this musculoskeletal system, and resources that actually teach you real world application strategies that you can go and improve yourself, I think are just, that's been my experience with the book. It's been 2 years. It's out now. Like when people realize there's a resource like that, they tell all their friends, and
Yeah.
practitioners tell their doctor, they tell all their trainers or their PTs. So I'm super excited. I can't wait to have your book in my hands and to be able to go through it and
You'll be one
share it
of the
with people.
first.
So yeah,
You'll be
yeah,
the first.
yeah. When do you get yours? It's got to be soon, right? When do you get your copy?
About a month and a
Some
half, 2 months.
Okay, you're close.
Yeah,
Yeah,
October
it's still
21st is the launch date of it
it
being
is.
available for everybody, but pre-sales are out now, and
Okay.
we're on that track. But yeah, hopefully I'll get my copy here pretty soon. It'll be weird. I know, like you did the unveiling, and it was
Yeah.
so cool. But having that, it's gonna be a great feeling.
It's a surreal experience. It's so cool. I'm excited for you, man. Where can people come find you online to learn more?
GetPPSC.com is Pain-Free Performance Specialist Certification site with all of our certs over there. And also at Dr. John Rusin on Instagram and Facebook, posting daily over there. And then obviously just type Pain-Free Performance into Amazon or wherever books are sold. You can pre-order your copy now.
Sweet, man. Thank you for coming on. Thanks for talking through this. Always great to catch up with you, and see you next time.
Thanks.
See you later, everybody. Bye.